This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the British Journal of Neurosurgery, published in 2026. The title is Spontaneous Speech, a robust measurement before, during, and after awake brain surgery in patients with glioma.
This is a topic that hits home for many of us in the OR. When we're dealing with gliomas, especially those in eloquent areas, our primary goal is often the balance between maximal resection and preservation of function. But for the patient, function isn't just about whether they can name a picture of a pencil on a card.
Exactly, Dr. Aris. The paper starts by acknowledging that patients with glioma often report language complaints that have a truly devastating effect on their daily lives. Even if they pass a basic naming test, they might still struggle in real-world conversations. The researchers aim to investigate if analyzing spontaneous speech could help us better understand these underlying language problems.
It's a crucial distinction. In a standard clinical setting, we often rely on standardized language testing, things like the Boston naming test or simple repetition. But this study looks at spontaneous speech as a robust measurement across the entire perioperative period. That's before, during, and after surgery.
Right, and the during part is what I find most interesting for our surgical residents. The study highlights that spontaneous speech monitoring is of significant importance during awake brain surgery itself. It's not just an assessment tool, it actually guides the tumor resection.
That's the key. When the patient is talking freely during the resection, it provides a continuous stream of data about the integrity of their neural networks. If we only use intermittent naming tasks, we might miss the subtle onset of phonological errors or a loss of fluency until it's too late. The paper argues that spontaneous speech monitoring contributes directly to maintaining language function.
Let's dive into the additional value mentioned in the abstract. Why go through the trouble of analyzing spontaneous speech if we already have standardized tests?
Well, standardized tests are often restricted. They are static. Spontaneous speech, however, is a dynamic reflection of how the brain integrates multiple linguistic and cognitive processes simultaneously. The study suggests that analyzing spontaneous speech provides insights that standardized language testing might miss. For a patient, being able to find the right words during a family dinner is more representative of their quality of life than naming objects on a screen.
The researchers really emphasize the perioperative period. They aren't just looking at the patient on the operating table. They are tracking the evolution of language from the initial diagnosis through the physiological stress of surgery into the recovery phase. This allows for a much more nuanced understanding of how the glioma and our intervention impacts the patient's communicative ability.
And for the residents listening, think about the intraoperative application. When we're mapping or performing the resection, we're looking for any change in the rate, the prosody, or the syntax of that spontaneous speech. If the patient starts to hesitate or their speech becomes sparse, that's a real-time signal to pause and reassess our margins.
It's about being proactive rather than reactive. The paper suggests that because spontaneous speech is so robust, it acts as a highly sensitive barometer for the patient's neurological status.
So, to summarize for our colleagues, the study reinforces that while standardized tests are our baseline, spontaneous speech analysis offers a deeper, more ecologically valid measurement. It's a tool that helps us navigate the delicate landscape of the brain with the goal of not just saving speech, but saving the patient's ability to engage with the world.
It definitely makes a strong case for integrating more formal spontaneous speech analysis into our clinical protocols. It's not just about what they can say, but how they say it.
A great point to end on. Thank you, Dr. Alara, and thank you all for tuning in to the Neurosurgery Hub. We'll see you in the next episode.
Goodbye, everyone.